Good morning. Thank you all for joining us today. Today, I'm going to be talking with Susan Riendo. She works in our radiation oncology as a nurse, and she will discuss a day in the life of a radiation oncology patient and what to expect. So I will pass it to Susan.
Hello, I'm Susan Riendo. I'm a nurse here at Dana-Farber Cancer Institute. I work in radiation oncology. I'm going to take you through the department so you're familiar with the day-to-day process and people you'll meet when you come to visit with us here in radiation oncology. Hi, everyone. I want to be sure that everyone knows that this video includes general information for radiation therapy patients. Depending on where we're giving you radiation, you'll have more specific side effects and you may have questions, and those should be directed to your physician or your nurse. Radiation therapy is located in the Dana building on L2. This is the front desk. This is where you'll check in every day and you'll see Neil and Bertha. They will greet you. They'll answer any questions that you might have, but you will check in here every day. On your first day in the department, you'll meet with your nurse and we'll review any potential side effects that you'll experience with the particular radiation treatment that you're going to receive. We'll provide written materials and we will also give you the opportunity to ask any questions that you might have in regards to your treatment. You'll be issued a color-coded card depending on what machine you're being treated on. We have 3 machines: green, purple, pink, and you will be treated on one of those machines. Every day when you come in for your treatment, at the front desk, you'll scan your card and it lets us know that you've arrived for your treatment. So when you arrive every day in the department, you're going to check in at the front desk. You're going to meet Neil and Bertha. They'll answer any questions that you may have, any concerns you might have, pick up a bottle of water or some snacks, and then they'll also give you any information that you might need in regard to visiting with your doctor on a weekly basis. Sometimes the days get changed depending on your doctor's schedule, but you can typically count on visiting with your doctor and your nurse the same day every week, always around your treatment time. This is the changing area where you're going to change for your treatment every day. They're individual rooms, and you can see that there's clean laundry, basically Johnny's, and dirty laundry. And you can, throw your dirty laundry. Please throw your dirty laundry away into the receptacle after your treatment. Upon arrival in the department every day, you'll scan your card at the front desk, walk into the department, get changed for your treatment, and have a seat in the waiting room. When the therapist is ready to bring you in for your treatment, they'll come and get you. Once a week, you'll meet with your physician and your nurse to review any side effects you may have experienced in the previous week. We'll tell you how to manage them, write any prescriptions that you might need, and we also tell you what to expect in the upcoming week. That way, there's no surprises when you experience any side effects. This is the nurse's station. Nurses are in the department every day, so if you have questions about your treatment, side effects from the treatment, concerns, please come to us. There's always someone that you can speak with. Pictured on the left is an example of one of the radiation treatment machines. You will lie on the table and the therapist will get you into position, and the machine itself will do all the work. You just need to lie still. On the right is an example of one of our immobilization devices. This is typically if you have a head and neck cancer, but depending on what you're getting treated, there are other immobilization devices that we will use. The reason why you may need to be fitted with an immobilization device is because we need to have the same area treated exactly the same every single day. That's very important for you to get a quality treatment. And again, if you have any questions, please speak with your doctor, your nurse, or the radiation therapists. Here's an example of a few of our therapists setting up for a patient's treatment. Again, this is an immobilization device that patients get fitted for their treatment. Not everyone will need one. The doctor will determine that. And as you can see, the machine moves around you once you're in position. This is a great example of what you'll experience in the room every day when you have your treatment. Every day when you come in for your treatment, we can play music to pass the time. So we have Spotify, and you tell the therapist what music you might like to listen to, if any at all. Some people like the silence and the peace. Others love to listen to music. Treatment every day is going to be about 15 minutes, give or take, again, depending on your treatment. And you are observed for the whole time that you are in the treatment room. You are in the treatment room by yourself every day. Once you're set up, and the radiation therapist will let you know that they're going to exit the room and begin your treatment. It's very important that you stay still, but you breathe as you normally would. When your doctor plans your treatment, they figure in that you're going to need to breathe. And so that is figured into your treatment. So you lay on the table, breathe normally. And if the therapists need to give you any instructions, there is a loudspeaker in the room and you'll be able to hear them. But generally, you'll come in every day, listen to your music or no music, and you'll receive your treatment. And as I said, about 15 minutes in the room every day, and you're being observed by at least 2 therapists, if not more, every treatment. The average radiation treatment takes about 15 minutes in the treatment room every day, Monday through Friday. We tell patients to plan on being in the department 1 hour every day, but it doesn't necessarily take that long. Most days you're able to come in for your treatment and leave and go to other appointments or even go to work.
All right, so now we are going to move into some frequently asked questions. So I will ask and then Susan will step in and give her answer. The first question, what should patients expect after radiation?
So again, this all is dependent upon the area that you receive radiation. So what a breast cancer patient is going to expect after treatment is in regards to side effects or the condition of their skin is going to be different than, say, what a patient that receives head and neck radiation is going to experience after treatment is over. Everyone, no matter what area that is getting radiated, will absolutely have some type of skin reaction. And then you can also expect that depending on where you're getting your radiation treatment, everything in that area is probably going to experience some change temporarily. There are some side effects that may last longer. Your doctor will speak specifically about that. And you also discuss a lot of the potential side effects that you're going to have after treatment when you visit with your doctor on a weekly basis. So there's no big surprises after treatment because we discuss it while you're receiving your radiation, and then you will have multiple appointments scheduled after radiation is completed with your various healthcare providers that can guide you through this point in time. And typically when people are finishing up treatment, we will give them written material as to what to expect specifically for the type of radiation treatment that you receive.
Great, thank you so much. It sounds like it's not one size fits all and that they're treated like individuals, which is great to hear.
Correct.
So kind of more into the side effects side of things, what are some side effects of radiation?
Yep. Definitely skin changes. There are always skin changes as a result of radiation therapy. What does that mean? So a lot of times it develops slowly, usually about halfway through your treatment. You'll see a little pinkness of the skin, and typically it fades a few hours after treatment. Then there'll be a point in treatment where it doesn't fade and that redness deepens, or you may have tanning or a combination of pinkness and tanning that deepens over time. We do expect that you'll experience most skin side effects probably about a week or so after treatment is completed. But again, your nurse, your physician, your caregivers will prepare you for that while you're actually still on treatment. So there shouldn't be any surprise. We'll give you any supplies you may need or make any skincare recommendations. Again, in regards to side effects, it's not just skin. It depends on the area that you're receiving radiation treatment to. So what a lung cancer patient is going to experience for side effects from radiation treatment is going to be different from what a breast cancer patient would experience, or someone that has head and neck, or even a primary skin cancer. And for specifics, that's when I would recommend that you speak with your healthcare providers about that. Because again, when you come in for your treatment on your first treatment day, we do review all the expected side effects with you, so there's no surprise. And again, if you have any questions, please ask your nurse.
Great, thank you so much. How do I care for my skin?
This question is always somewhat complicated, and it doesn't have to be. The thing is, you could speak to 50 different radiation therapy centers in 50 different areas of this country, and you're going to get 50 different recommendations as to how to care for your skin. If you have any friends or family members that have had radiation in the past, they're going to want to try to help you, tell you what to expect, and they'll give you their perspective, what they use for skincare and what worked for them. And that is all helpful and sometimes confusing. So again, I always tell people to speak specifically with their healthcare provider or their nurse, because they will meet with their nurse on that first day of treatment. I find that simplicity works best. Don't overcomplicate things. It's basically going to be Vaseline or Aquaphor that we give patients here at Dana-Farber. And if there's something specific that you would like to try, I would speak with my nurse or my physician in regards to if it's a good choice for you.
Great, thank you for breaking that down. I think it's really important to kind of go through these questions with all these great answers. So next, how long will it take for me to recover from treatment?
This is also highly dependent upon the area that is being treated. So typically, any skin reaction that you've had from radiation treatment, that's going to resolve first. That's going to typically be resolved within the first, let's just say month. It could be sooner than that. But your skin reaction's going to resolve fairly quickly. And you'll see it. It's like if you've had too much sun and you've had a sunburn in the past, It quickly fades. It might be dry. You'll still have to use moisturizer and, keep it clean. Again, depending on the area that's being treated, it's going to take longer and shorter amounts of time to recover. If you're a head and neck patient, there are going to be effects from radiation treatment that will take you longer to recover from. There's an acute recovery phase that, we consider like the first 3 months of treatment for the head and neck patients. And then the recovery is slow and steady. Again, it depends on where you've had treatment. It might give you dry mouth. Again, let's say if you're a lung cancer patient, you might have issues with esophagitis, which is like an irritation of the lining of the tube that you eat. When you eat, it goes down your esophagus. That might give you some heartburn. So it could take a little bit of time for that to recover. And you might be on medicine for that. So this really does depend on where you're getting your treatment from, treatment to, excuse me. We do our best to prepare patients for what to expect during treatment, but also after treatment when they're recovering. We try to discuss this while they're on treatment, give people written information. So when they're home and they're like, oh, geez, it's like, what is this from? Oh, wait, let me just take a look at that written material that my nurse gave me. And it's like, oh, they did say that I might have heartburn, or they did say that I might have some mucus or dry mouth, or my skin would be really dry. Oh, this sounds like it's normal. And again, if you have any questions, you speak to your nurse. We give you our phone numbers also on that written material. So never hesitate to call.
Thank you. It sounds like communication with your nurse and your care team is really key in recovery.
Absolutely. And the thing is too, I always stress to discuss any concerns that you have with your nurse or your caregiver, because many times what you think is a concerning side effect or, makes you feel uneasy is something that we're actually expecting, and we can give you ways to strategize through that period of time. And I always tell people, please talk with us, especially if it's like before a weekend, because a lot of times it's like I said, it's something that we expect, and it just cuts down on unnecessary worry on the patient's part.
Great, thank you. Will I receive follow-up treatment or scans?
So again, this also does depend on the area that you're getting radiated, but typically when you initiate your treatment, whether that just be surgery and radiation, chemotherapy and radiation, chemotherapy, surgery, radiation, that's all presented to you when you first have your diagnosis. We come up with a treatment plan. So you'll have a general idea of all the treatments that you will be receiving. As we approach the end of your treatment, as I said, we discuss these things in our weekly visits. We also have, like I said, the side effects expected after treatment written down so you can refer to that. But also there's always a very clear plan in place in regards to any follow-ups you might have with other providers other than your radiation doctors. There's also a plan in place, and the timing of this is also important as to when you would get any type of follow-up scans, PET scans, MRIs, CAT scans, any blood work. There's always a very clear plan in place when you finish your radiation treatment as to how things will move forward. You'll never wonder, oh geez, what's the next step? Because that will be very clearly mapped out for you when you finish your radiation treatment.
Thank you so much. And that was our last question. So thank you, Susan. This was a really great presentation, and thank you so much for working with me to film those videos and get everything prepared. I hope that you all enjoyed this and you'll be able to go into your radiation treatment a little less confused about what's going to happen. We really want to ease some of those concerns and thoughts. So please let us know if you have any other questions. If you do want to watch some more programs and workshops through the Blum, please visit our website at www.dana-farber.org/resource center and check out our YouTube playlist, which this will be on as well. Thank you all. Have a great day.
Bye.